because I sold my house, I sold my car, my job and my city. I moved to Philadelphia.
In, let's say, 10 years from now, what will be the major changes that you would foresee?
I think artificial intelligence is going to change the way we are treating patients. I'm quite sure about that.
What would you consider the most defining moment in your career where you say, look, this is a decision that I took or a moment that I had that really changed everything?
I just wanted to prove myself, trying to be the best dentist that I could be. I'm like a stubborn, I'm like, if I put something on the focus, I try to keep myself in this track. I think it's very sad when you go to a congress, an educator is just showing how well things go.
Everything's perfect.
Let me tell you, that's not the truth. I have failures every single day.
Welcome to this third episode of The Pulse of Dentistry. I'm Andreas Utz, and together with my colleague and friend George Reber, we are very happy to host this series of inspirational conversations. And the podcast Pulse of Dentistry is about, interviewing remarkable personalities in implant dentistry and, to engage them in a conversation around their personal development journey, pivotal moments in their life and in their career. It's about clinical innovation, it's about technology, and of course, it's about the future of dentistry. And today we have a guest that is having a lot of talents and a lot of interests, and we are very happy to have Oscar González today with us. Oscar, you are very active in academia. You are affiliated to two of the most prestigious academic institutions worldwide. That is the Harvard Dental School, and that is Complutense in Madrid. Also, you serve as the editor-in-chief of the Journal of Periodontics and Restorative Dentistry. And I think that reflects very nicely also your specialization, which is periodontics and prosthodontics. And beyond that, you are, a very well-respected implant specialist. You are very active in some key associations, I know, very active politically as well. And last but not least, you are running a very nice dental clinic, private practice clinic in the center of beautiful Madrid in Spain. So, Oscar, it's really an honor and a pleasure to have you today. Welcome to our podcast.
Oh, thank you very much. The pleasure is mine. It's my first podcast in my life. So I'm very honored to be here. Yes.
Oscar, what we try to do, we try to make it a habit that, our guests, they present themselves to our viewers and listeners in 1 minute, because not everybody knows you. You are very famous, but not everybody knows you. So who is Oscar González in 1 minute?
Well, thanks God, everybody knows me. That's a good thing. I don't, the way I am, I try to be quite shy. I'm trying to get some type of solid career, and whatever is solid career take time. So starting from the last thing that you mentioned, I'm a clinician. I'm a dentist. Of course, I enjoy very much treating patients, and there is another side of my career, which is research and education that I enjoy very much. I cannot call myself a researcher. I think that's a very huge word for me. I try to do my best and what I am is a very curious guy. I try to answer some clinical questions that I have in my daily practice. And this is basically it. But again, I'm a dentist pretty much, that I try to do my best to take care of my patients, yes.
Oscar, to reflect on your impressive journey that you have behind you, it seems that you have been a very curious person, and it's also, I think, a motto of your dental practice to be keep learning, keep searching. Mm-hmm. So you combine those two elements very nicely. On one hand, you have a very nicely running practice, but on the other hand, I still would consider you as a researcher. I looked through PubMed, and you have a lot of peer-reviewed publications. So it's kind of a dual track. And what made you choose this path?
I think it's the enthusiasm. That's the word that I think it will appear a few times during this podcast, because if I'm able to do all these things, it's because I enjoy that part of the career. We spend so much time trying to develop a career, a job, that I decided long ago to enjoy that. And as part of that, there is a intellectual activity or an intellectual question that came to my mind, and I just try from time to time to answer some of them. So to combine both things, it makes me feel that I'm updated, which is also good for my self-confidence, but also for the wellness of my patients, that I can provide them maybe some solutions that if I was not that updated, I would not be able to do that. But that's the motto for doing that. Yeah.
Oscar, before we started the podcast, we already had a very inspiring conversation, and we know that your career was anything but not linear.
No.
And I think sometimes that's a really good thing to happen. What would you consider the most defining moment in your career where you say, look, this is a decision that I took or a moment that I had that really changed everything?
That's clear in my case. I started as a pediatric dentist. I was working for 6 years in private practice when I was in my hometown, Sevilla, in the south of Spain. And actually, I was working in a very nice office over there with very good clinicians. But suddenly, when I was 27, 28 years old, I felt that I need something else. Not because I wanted to be a known dentist or because I wanted to be famous or anything like that. No. I just wanted to prove myself, trying to be the best dentist that I could be. And then I heard about it was a funny story, but making the story short, I heard about this postgraduate program, dual program in Perio-Pros. Now Perio-Pros has become like the goal to be interdisciplinary. But at that time, Perio-Pros, it was not that famous.
Not so known, not so famous.
Yeah. I mean, it was very famous in the 50s, in the 60s. And then people went to be like a super specialist and something. When you become a specialist, you become focused in a small part of the profession. And I always remember one person who really changed the way I see dentistry today, which is Dr. Morton Amsterdam. He created Perio-Pros program at the University of Pennsylvania 80 years ago, and I had the privilege to be trained by him. And he always say that. He always say, at the beginning, all the dentists were general dentists. Then it became the specialist. Then the super specialist. And think the future is to be a super general dentist. It doesn't mean that you have to do everything, but you have to have a broad vision of what is dental health or what we can provide to our patients. And that, of course, changed the way I understood, where I still understand dentistry, because I sold my house, I sold my car, I left my job and my city. I moved to Philadelphia. Listen, very different to Seville. A lot of snow, something like that. And I worked hard for 4 years. I have the privilege to be trained for amazing faculties, but also to have great colleagues studying with me. I mean, to have a good class with you is always very good because we push each other up. And I think that changed my career because I remember perfectly well. I make numbers, how much it cost me and how much it cost me to take a nap, which in Spanish is a siesta. Mm-hmm. So I make the calculation, I didn't take any. I say, I cannot afford to take a nap in these 4 years. It's too much. It's too much money to do that. No, so it was 4 very worthy years, and then it was another moment of my career that after that I was doing my 3rd year in Imperial Pros at the University of Pennsylvania, and I went to Princeton for a lecture of someone called Urs Welser, and I sat there. I say, wow, I want to learn from this guy. I just want to learn from him. So in the coffee time, I approach him and I say, how can I learn that? And he just told me there is this thing is called the ITI scholarship that you may apply. So I decided to apply to push the loan for the bank for another 2 years. And I was lucky enough to receive that. So I moved from Philly to Geneva, from English to French. My French was so poor that I struggled quite a lot, but it was, there is no question, a very important experience for me.
So, I mean, you've been in practice already, ready to continue your
6 years.
dentistry career,
Yeah.
and still decided, to not take it the easy way, but, to learn all of this and to go to Geneva and to learn in the program before. What kept you motivated throughout those times? I imagine that was also tough at times, huh? But what kept you going?
That's, I have no merit on that. That's the way I am. If I have a good thing, is that I'm like a stubborn. I'm like, if I put something on the focus, I try to keep myself in this track. So it was a huge decision for me to leave my family, to leave my life. You have to try to do your best after taking a decision like that and stick to your purpose. And I think that was the thing.
What gives you energy for everything you do today? Because, I mean, you run your practice, you're lecturing, you're active in associations, you do peer reviewing interesting research, so that also takes a lot of time. What gives you energy?
These 2 words. One, I used it before, still enthusiasm. I take everything, I enjoy what I'm doing. But the second thing is responsibility. I think that's the second word that I will use. I think we have very beautiful profession, but we are treating patients, human beings. So we have to be very, very careful, trying to do our best. And that's what I try every day. And so I take my job with a lot of responsibility. And that's the second word.
Okay, yeah, that's beautiful. Oscar, maybe to close on your personal development journey, what is the coaching recommendation or tip you wish to have received, like in the beginning of your career?
Well, that I don't know. If you ask me if I will change anything, I will change nothing. With the good part and the bad part. And I'm what I am today because I have good things, but I have some time in my life that it was tough to keep going. And but you have to wake up in the morning. And that's something that I can tell I haven't missed one day of job in my life yet. I hope I will continue this way. That will be a good sign. But you can imagine that in life after I'm 48. So that means that this year is 25 years since I finished my career, 30 since I started my dental studies, so 30 years taking care of on this business is quite a lot. And of course, there is some days that you don't feel like waking up that day, but you have to wake up.
Yeah, but I think it's beautiful if you can look back at your journey like this and then summarize it like this.
Yes, I think it's the way it is, yes.
Now, to change gear a bit, I think after that conversation that could have lasted quite some more time, because I think it's very fascinating, your personality and how you actually push forward. Let's talk a bit about your clinic.
Mm-hmm.
So it's called Atelier Dental.
Yes.
And I think it very nicely combines art with dentistry. And also listening to your life story, I believe that there is a big passion for, on one hand, being human and treating your patients as humans. But on the other side, you're also very much on the innovation side. So you're fascinated, I think, by modern technology. And let's start to look into this a little bit. So when we talk about innovation, then it's not often clear in the beginning that something will become meaningful and help us to change the way how we work. And you seem to be a person that is actually on the leading edge. You must have tried things that are not obvious that one day they will actually change the way how we work. So how do you decide what you take into your clinical practice? And, is this something that you decide by yourself, or is it a team approach that, is looking at the new technology, at an innovation, and then deciding whether this is something actually that fits your practice?
It's a great question, and there is a lot of different sides of the same question. You mentioned the team, and of course, if I can be sitting here, it's because I have an excellent team. We are 18 people working together. I have the responsibility to lead that, but they are each of them is there for a purpose, and they are pushing me up every single day. But at the end of the day, if you are the leader, you are the one to take the final responsibilities and decisions. And I will say that there is three things that I always try to do. Three. The first thing is to be prepared. Before you jump into an innovation, or before you decide to implement something in your daily practice, you have to be ready, you have to be trained, you have to study. And study doesn't mean to spend 5 minutes reading something. It's just to go in depth into what is the topic. The second thing is, I will say, critical thinking. I think you have to be critical. You don't need to eat whatever is supposed to be innovation. You don't need to eat whatever someone is telling you this is going to work. I think you, especially when you are being around for 25 or 30 years or 15 years, or even if you're a beginner, you have to listen. And of course, when you are a beginner, you have less critical thinking and you have to hear more. And then the balance started to change a little bit, but with always being critical. And the third thing I try always to have is some common sense, which is not always so common. So I think these three things: be prepared, study, you be critical, study and evaluate the pros and cons of every single thing, and then try to apply that in a very common sense. It's not every treatment is from everyone. Your team has to be ready also for that, has to be trained for that. So every time you have to innovate, some people or some organizations are trying to get a new thing in a very fast way. It doesn't work in Atelier. Every time we have to put something there, I put this very simple example. I develop a protocol, I will say 4 or 5 years ago. But the project was not ready for that project. So Atelier was not ready to implement that. So the circumstances are coming 3, 4 years after. Okay, now we are ready to do that, because if you rush too much to try to put this into the daily practice, it may be a disaster. So things also have the right time to do that. So
I fully agree. I mean, there is always the timing, I think, makes a big difference. And, sometimes you have a very innovative idea, but maybe the environment is not yet ready that you can do it. Is there an example where you actually tried to implement something and you learned, and then also you had to abandon it again for a while? Is there anything that comes to your mind?
I have a very clear example of something that it was in my mind 9 years ago when we opened Atelier, and happened last year, 8 years after. The example is very clear. We opened a year ago a head and neck rehabilitation center as part of the dental treatment, or as part of the dental health, where we also treat sleep disorders or TMG problems. We were not ready before. We have to put the basis before we were ready to put the next step. And that happened 8 years after. But it was in my plan, written 9 years ago. So, and of course, sometimes I have tried to put something to work, and then I realize, okay, we are not ready for that. Let's wait. I will not abandon. That's something that is funny.
Not in your nature.
No, actually, I'm publishing now a paper with Professor Belzer that it was written in 2007, and it's going to be published next year. I wrote that at that time. I had not even the experience to write something meaningful at that time. But almost 20 years after, I took it back. I wrote that again with the same people that was involved, and then I sent it to Professor Wells, and I say, now it's worth it.
Now
Let's
it's
do
the time. That's the time. Okay.
That's the time.
That's a beautiful story. Now, you seem to be a person that is keep searching, keep changing as well. And I think for your team, that can also be quite demanding, because they actually, they need to go along with you. Reflecting on yourself and on your team, what do you think is more critical? Is it like the skill set or the mindset?
That's clear. The mindset. Yeah, that's for sure. I'm always changing because I'm still work in progress. I haven't finished myself as a person. I think every day I try to be a little bit better, because I'm still not good enough in everything in life. I mean, still I have my lights and my shadows and everyone else. I just try to be a little bit better every day. Not always I achieve that. But what I ask to my team is, I'm ready to lead. I'm going. And I don't need you to be right here, but at least one step behind. And everyone has his own speed. I don't want anyone to be stopped and looking how I go farther. No, you go to your own path, but you have to come with me. Because for me, your loyalty is, I know it sounds very old word, but for me it's crucial. If you want to be part of our project, of Atelier, you have to stay loyal to Atelier. And that's for me is very, very crucial. And the skills can be learned. That almost everything is written. So I think it's more a way of being that how good you are with your hands.
So you're also recruiting for mindset when you extend your team?
No question.
Yeah.
And do you do specific events, or do you invest specific time for your team to take the team with you and to make sure that they are following you and you create stuff together? How do you do this?
Sure, we do a lot of things. At least once or twice a year, we do some type of, we go for a weekend all together, or we go to sing in the karaoke, whatever. But we do things. And then once every 2 months, we close the office for one day. Actually, it's going to be the 19th of December, the next one. And we do a kickoff of what are we going to try to do next year? What is in my mind? For some time I have to sit and tell them, listen, this is in my mind. And I think this is not going well, and we have to improve that. I'm very critical with myself. I have no issues to tell my team, listen, I have to improve this and this and that. But also to tell the people that they have to improve few things also. It's important to be honest, always in an elegant way, in a nice way, in a gentle way. I tried, that's something I have tried to polish quite a lot during my life. I try to reduce my excess of energy and try to be more cautious, try to do not hurt anyone, but also to be honest with people.
Maybe the last question to this practice block. You're also a very, I would say, thorough educator, and you provide a lot of courses. So what would you consider, let's say, the three things that when people join you can learn that are important?
Oh, what they can learn. The most important thing that they can learn from if someone take a course with me is that we share all the same issues. We all have the same problems. We all have failures. I think it's very sad when you go to a congress and you have your own patients and then you see an educator is just showing how well things go.
Everything's perfect.
Everything is perfect. And let me tell you, that's not the truth. I have failures every single day. And if you share that in a very honest way, if you share with your colleagues that we are all together in the same field, which is treating the oral health of our patients, you fail. And you fail every day. So what I try to teach or to share, because I don't like the word teaching applying to me. What I try to share is some key ideas about how to make a good diagnosis so you don't fail that many times. So instead to fail 4, you fail 3, that course is worthy already. Second, if you fail, what you can do to solve it, if there is anything that you can do to solve it. And then I try to share a vision, an interdisciplinary vision that is in my core. So it's very difficult for me to give a course of implant dentistry alone, or periodontology alone, or restorative dentistry alone. For me, it's very difficult to do that. So for me, this interdisciplinary view is it will be something that you can breathe in my courses. That if the American always say, if you have a hammer, everything you see is a nail. So no, for me, you can see that you solve problems in implants by using orthodontists. I may not do that, but my wife is an orthodontist, my brother is an orthodontist, or you have people in your team who is an orthodontist or endodontist or whatever. So that will be, if whoever make a course that I'm trying to give to someone, and after the course they have the feeling that this time here was worth it, because I can see I have learned few things, but also I can see that why I felt that day, that will be perfect for me.
That's worth it.
But that seems really to be you, huh? I mean, multidisciplinary. I mean, looking on all your specialties that you have collected over the years and worked hard on this. That's very true. I was looking on your website, and I have to say, your website really fascinated me, because it, spells out a clear philosophy and a clear direction, and it's beautifully designed and very aesthetic. And I think that tells already something to the patient. And what I would like to do is to speak a little bit also about technology with you. And there's a statement that I want to read because I found it fascinating how you combine this. And the statement in your philosophy is, although we like to be at the cutting edge of technology, many tasks are best performed by hand. And I think that's very true, at the end. And that's the name of your project. It's Atelier Dental. So it's about technology, but a lot is about art and being handcrafted as well. So I'd like to go a little bit in this, topic to distinguish where do you find technology very, very helpful today, and what are the topics where say, look, this is really where craftsmanship is leading the way.
I have to mention something. That quote, that I love it, actually is Swiss.
Okay.
This is adapted for watches technologies.
Okay.
And it's not exactly the same, but quite similar. And technology, of course, has changed the way we are doing dentistry today. And I can envision that I have still 20 years of dentistry. If everything goes fine, that it still is gonna change many things. But we cannot forget the human touch. I think that's important. So if we are able to combine both, then this profession is something very enjoyable, because the good thing about dentistry is that you can combine science with art, with health, we're health providers, with beauty, with human touch, with it's amazing. But also for those guys who are amazed about innovation and technology, today digital dentistry is amazing. They can make a life only about that, and enjoying with all these machines that when I looked at them, it's like, wow, who's gonna manage that? I think for me, it's like, okay, what was that? And how that work? How much cost? So that's the three things that you have to ask yourself. But there is no question. There is a lot of new technology that are gonna make a revolution in what we're doing today. I opened 2 years ago. I opened what you call a research center. To be honest, research center is a big word. I will say that it's an area where I have fun, because I'm 48. I'm from the analogical time. And unfortunately, I was seeing the digital running, and I was like, okay, I have two options. Either I jump, and I'm not jumping if I'm not trying to lead that, or then it's going to kill me. So 2 years ago, I decided to invest, 2 years and a half, and we opened a space like this room, small one, with a lot of machines, printers, scanners, and just playing. If there is a new material, I want to see what is this material, and it's better if you treat it this way or this way. How much is the thickness of that? How can I improve the restorative part of my patient by doing that? Also, I've been working with a company for artificial intelligence in dentistry, just trying to learn. For that, I'm just trying to learn. It's too late for me. I don't even have the ambitions of leading that part, but at least I don't want to be the last one on the list. I want to be there. I want to be there. I want to know what's going on, because it's fascinating. It's amazing.
I'm absolutely on the same page, being fascinated about technology. And, just going quickly through some of the publications that you have been doing, I was, amazed that already in 21 you published about reverse scan bodies. So, as someone from industry, I'm always fascinated by, clinicians that actually try out new things, because I believe those people that actually try to solve their own problems are sometimes coming up with the most innovative solutions. And I just wanted to ask you a bit how you perceive, for example, in your, let's say, time that you explore new things, how is the cooperation with industry? What does work, and where would you see actually improvement potential? Because I believe the magic happens somewhere in the interface. So we can't do it alone, and probably clinicians can't do it alone either. And we need to have this interface where, we co-create.
Well, this is, today we need the companies, we need the industry for that. If you want to do something, you put the example of I call it the inverse scan body, because I was the first one who thought to do that, applying to that particular topic, to that particular purpose. Then I saw that it was a big thing, the reverse scan body, and basically it's the same idea that now is helping a lot of people. If you want to do something to a big scale, you need the support, because being in a private clinic, you have a limited resources. Your time is limited, and also the cost of any of those innovation or ideas is very high. I feel myself a privilege because I have an access, or I have a very good collaboration with different industries that, and that I cannot be just thankful for that. It's true that not every clinician has this possibility, but I cannot envision now a way of how to really click that in a better way. But I'm sure there's amazing ideas out there that unfortunately are not spread because they remain there. And as you mentioned before, at the end you abandon that, or you lose the energy to put it out there. Also, to publish is not easy. One of the most important things that I'm trying to do, or the one I feel more proud of being a co-editor, first of all, has been a learning experience for me, because I never been an editor before that. Now it's 2 years since I'm doing that. But the most rewarding thing that I'm trying to do is to help people who has never published before to get the first publication in a peer-reviewed journal. It's a process. It's a learning process. We all have rejected papers in the past, because your first paper, you are not ready to write that. You are not ready to. Maybe the idea is very good, but then you have to put it in the right words. So in the same way that I'm trying to help these people, and if you don't have someone to guide you, that ideas are not going to be ever published. In the same way, I'm sure there is excellent ideas out there that it will be very nice how to explore the way to put all these ideas to the service of the community. But I don't know how to do that.
Oscar, I know that you are also doing a lot of immediacy treatments, if we go a little bit into implant dentistry now. Today in your practice, when you do implant treatments, how many or what percentage of your patients do you treat with an immediate approach, meaning, let's say, an immediate provisional?
Well, I like to distinguish two things. One is an immediate implant, one is an immediate provisional. Mm-hmm. I do almost 80% of my procedure are immediate implant. Actually, next year is going to be 20 years since I did my first immediate implant placement. Next year, 2005 was my first one. So I am crazy about immediate implant placement. Immediate provisional, because I have some gray hair now, I'm getting more conservative. I choose now very well those cases where I try to immediately provisionalize or load them, because at the end it's a load, whatever you want to call it. Because I want to be very consistent. I'm not in the age of making experiments. I make all the experiments I have to do. As I mentioned before, I'm quite critical what I'm doing, and also I introduce my common sense. So yes, I'm crazy about immediacy. Just because you place the implant the same day you remove a tooth, you're saving time, you're saving surgeries, you can manage things in a very conservative and minimally invasive way. For me, that's a must. The second part depends on few factors: the primary stability, the occlusion of the patient, which type of patient you are trying to do. Is a full mouth, which you have a few implants that you can load, or is a single tooth. There are different situations that I have to evaluate very well before going to immediate provisional restoration.
And if you look now, you said you did your first immediate case 20 years ago.
Yes,
So next year you can celebrate an anniversary.
absolutely.
So if
Patient as well.
patient
Yes,
as well, hopefully.
yes.
So if you look into the last 10 years, what has been the major technological breakthrough for you to support you in successful immediacy treatments?
There is few of them. Of course, everything related planning, that's crucial. I mean, to make today an immediate implant without proper CBCT or right analysis, I think that is just buying tickets for a failure, and or not maybe not in the short term, but maybe in the long term. So, of course, CBCT has been there already for a few years more than that, but in the last 10 years, the technology has evolved, and then you have a lot of beautiful tools. You can plan where the implant is going to go. Even you go to guided surgery or not, but you plan. That's the first thing. The second thing, there is no question, the change on the design of the implants. You cannot think in placing an immediate implant or immediate implant with immediate provisional restoration without a proper anatomy of the implant or microgeometry of the implant or proper features to have a successful result. So if I think in that first implant that I placed 20 years ago, wow, I took a lot of risks. Actually, it's a funny story because it was an immediate implant placement in a central incisor in a lady, high smile line, and I did immediate implant placement and immediate provisional restoration. After I finished the procedure, the faculty told me, okay, now you should know that was the first immediate implant, immediate provisional in this university ever.
Really? Wow.
I was like, okay, thank you. Thank you for letting me
Thanks
know.
for letting me know, exactly.
Thank you. I very much appreciate it. Actually, I still show that case today. Because, it was something that was my first experience with that, with all the shaking and all the lack of knowledge at that time. And if you take a look today in the implant itself, I don't know even how I achieved that primary stability. I don't even know how that survived to that surgery. So I think that will be my two main features or main advantage in the last 10 years for immediacy.
And now that you speak with us, what would be your wish to the industry to say, look, if you really want to improve this over the next 10 years, this is, guys, really what you have to look into?
I will not look that much in the surgical part, but in the restorative part. Implant companies have sell implants. That's what it is. But unfortunately, they forgot about the restorative part. We have been I'm restoring my own cases. I sometimes feel myself limited with what this company is providing me to restore this particular implant. I don't have the tools to do that. So I believe now is a very interesting change. Now I see that the companies have realized that, the implant itself, if you take a look, it's there. It's close. I don't see many changes in the last few years. However, we have still a lot to implement in the restorative and, of course, that coming to the digital too. So I think the restorative part will be something that will be evolving in the next few years. new materials, new design, new transmucosa, new emergence profiles, new things. That is, at the end of the day, is that what the patient is looking for. They're not looking for an implant; they're looking for what is supporting the implant. So I think we have to start focusing there.
Yeah, that already brings us quite close to the end of our podcast, which I really enjoyed so far. It was great. We have a routine that we want to ask you, just 2 questions that I know we ask everyone. And the first one is a very visionary question. So how do you envision dentistry in, let's say, 10 years from now? And what will be the major changes that you would foresee?
I don't know what is going to happen. This is a wish. This is a wish. I wish dentistry is evolving to a more broad view of the patient, more interdisciplinary view of where the patient receive also a more expand treatment, more complete treatment. I think we're in the good lead for that, and that's a wish. But also, I think the big changes, more not so philosophical, but more into the reality. I think artificial intelligence is going to change the way we are treating patients. I'm quite sure about that. I don't know if it's going to be in 10, in 15, or in 5 years, but it's going to happen. And there is also one extra thing that I believe we have to improve, which is materials. We don't have the perfect material yet. We don't have the perfect material to restore a case. They are not perfect. If it's too soft, it's not holding the forces. If it's too strong, it fracture. If it's fractured, it's catastrophic. It's where is the best?
It's a big trade-off. Yeah.
Even implants. We have titanium, we have zirconia, but when the bacteria runs there, listen, you start suffering. And we're improving there, but still, I think we are missing, especially in the restorative part, better materials to help us to give a better treatment to our patients.
So still a lot of work to do. That's good to hear. Now, on a more personal note, Oscar, so if you could invite any person that you could think of for a evening-long fireside chat, who would that be and why?
I have to invite 3. I'm sorry.
Okay. Go for it.
I have to invite 3. And one of them is not possible anymore because it's not here anymore. But it will be 3 people that have an impact in my career as mentors for different reasons in different time of my life. Which it will be Morton Amsterdam, where I spoke before about him. Of course, it will be Professor Belzer. And it will be Professor Mariano Sanz. I will sit with 3 of them. I will just say thanks to them. I will just sit and listen what they have to say. It will be a beautiful chat between 3 of them, and I just will sit there and keep learning from them as I did or I tried to do still with some of them every day.
Okay, Oscar, that sounds like a very nice evening. I could imagine you open a good bottle of Spanish red wine with it.
Exactly.
Yes.
And that's going to be a very inspiring evening. I could imagine. I would love to be part of this. So, yeah, this really brings us to the end of this podcast. Thanks a lot, Oscar, for your sincere insights into who you are and your journey and how you see dentistry. That was very inspiring.
Thank you.
We also want our listeners to be able to ask questions. If you want to do so, please write us a direct message just on Instagram, either directly to me or to George, if you wish, or to the Straumann channel. And yes, look forward to the next episodes of The Path of Dentistry. And with this, Oscar, many thanks. And George, thanks for hosting this exercise. Thanks a lot.
Thanks a lot,
very
Oscar.
much. Thank you so much.